Yeah.
I was just
A little
going
bit.
to say, go ahead.
So yeah, in case everyone's not aware, I have a master's degree in behavioral psychology.
Nice, you do this lecture. Go.
I totally could. I totally could. I was going to actually take myself out because it's a little unfair. But behavioral is
No.
there's a lot about behavioral versus psych, and a lot of that is in the diagnostic stages. And we seeing somebody new onset are not necessarily going to know where these things fall, right? Somebody
Hmm.
could have new onset schizophrenia first time uh, that we're seeing it, right? And that's a psychiatric disorder, and that's chemical imbalance in the brain where your brain receptors are sort of out of balance, out of whack, and that's controlled eventually by medication. Behavioral issues can be controlled by medications, but the biggest difference between behavioral and psychiatric disorders is behavioral disorders with the right therapy could be controlled without medication. Psychiatric can't. And behavioral disorders are highly influenced by environment and environmental factors. So a behavioral disorder can be seen in a violent episode in response to um, any number of things. Behavioral episodes can be one-time incidents.
So, Elizabeth, tell me what's the number one behavioral disorder that we see every day in the United States?
Oh God, I don't even. Yeah, that so
Autism?
what?
Somebody, I think somebody said it.
Autism?
Autism.
Well, so
Would you?
yes. Yeah,
So,
so right, let's go back to what did I do for a living as a behavioral therapist? I treated autistic children. Right?
mm-hmm. And so
Um,
you know that there's a spectrum.
correct.
Mhm.
Although I'm not sure where I stand on the level of um, being sure that some of that is a true statement versus our current understanding, because that's literally my field, right? I spent 30 years, I've published over 100 articles on autism. So
Okay.
I'm not fully convinced that autism is a spectrum, and there are parts of autism that I think may be strictly behavioral disorders. There are parts of
Correct.
autism that I absolutely believe are psychiatric, and we just haven't
Okay.
maybe figured out more than 1% of the brain at this point. So,
No, you're absolutely right. And again, so now my thing is I have, in my career I have dealt my son is on the spectrum, but
okay,
luckily he's on the low end of the spectrum. He's very intelligent, but he has his stimming and he has his behavioral issues.
correct.
He was antisocial, correct? Usually they tend to keep
Yep,
to themselves. He didn't speak for a long time. So there's a lot of them who are nonverbal autistic. Okay.
yep.
Um, but then you have the other ones who, you could get along with, and all of a sudden they'll grab your hair and try to rip your hair out.
Yeah, yeah,
Yeah.
yeah.
So,
So yeah, I
so,
would, yes, so right, I'm a BCBA, which means something to you if you have an autistic child.
yes.
It doesn't probably mean anything to the rest of you people, but that's what I am. I actually started the BCBA program in New York State because came from
I see.
Massachusetts and actually started that program here. Yeah,
Thank
yeah,
you.
founded the Young Autism program out in Smithtown.
Awesome.
First started and
But
took it from there. But
so,
anyway,
Well, the
I
the,
digress.
so the whole thing
It,
is, and just
so,
like you
so
said,
the,
it's not for us to diagnose
correct,
whether it's a behavioral or psych, right? That has to be done by a physician and lots of testing, first of all,
correct.
right?
And I don't think
My
our
whole thing
approach
is,
change all that
no, it
much.
hasn't.
Well,
Nope.
in the field, right? Your approach isn't going to change, whether it's a behavioral
It
disorder or a psychiatric disorder.
correct.
It's not going to change.
Nope.
I would say the only bigger difference with somebody who has a diagnosis, for sure, right? They're diagnosed schizophrenic. You can tell by the medication list. You know this, right? You know they're diagnosed
Right.
bipolar. Um,
Right. Right.
the
Right.
difference between somebody who's in like a true psychosis versus somebody who's having a behavioral outbreak or a behavioral issue is you could probably, if you had the right training, deal with the behavioral issue. The psychiatric, that psychosis, medication. It's the only thing that's going to break the
And
psychosis.
yeah, and and this is the problem that we're having right now in EMS with the police, and we see it all over the news. How, you know, how are people who are not educated in the medical field supposed to know when somebody is having a behavioral issue, a psychotic break, or legit want to hurt you?
Mhm. Mhm.
It's a
Which
huge
could be
discussion.
stemming from either one, right?
Exactly.
Or
And,
either
and we
one.
we just don't know. So now if you have training to approach, people in any way and try to calm them down, congratulations, I will take anything. But there's only so much time in EMS that we can take to approach somebody and allow them, to get themselves on our ambulance. They give us 20 minutes on scene, right? Is 20 minutes going to work for every single patient?
Is 20 minutes going to work when your EMS
Meaning,
provider doesn't have the kind of training that
exactly,
somebody like I do?
exactly.
I mean, listen, there's a reason why when I show up on an EDP call, people are like, "Oh, thank God," right? Because I can usually make it better, right? But that's years of work and training, years
No, you're
and
right.
education. It's a skill that I can I can't even translate. It's hard to teach because
And
it's so
thank you for that answer. So I was going to say, forget empathy or anything else. It's a skill that's hard to teach because it takes patience.
well, and years of knowing the right words and what kinds of things,
Words,
years of
tools,
experience and right,
body
the
gestures. Yeah.
approach to an autistic adult who's in a who's having a behavioral emergency is so defined and yet not, right? Like you
Hmm.
start with a certain round of questions, you start with a certain round, but like the kinds of things that people do, right? People tend to want to try and make eye contact. Worst thing you could do. Worst thing you could do for an autistic person having a behavioral outbreak, right?
Right.
Eye contact is the worst thing you can do, but there are things that people tend to do in their approaches that just actually make the situation blow up, and I see it all the time.
No, exactly. You're absolutely right. So the answer is, you know, do we have these FDNY units now that have a social worker or somebody who is trained, in
Yes,
dealing with this? But how can you send? I mean, there are so many, ambulances out there. You can't send a social worker out in 500 ambulances or whatever there is to the hundreds of thousands of cases that we get all the time.
correct.
So
And
the
not all
answer
of them,
also is not,
and
yeah,
a true psychosis, right? I don't need the social worker. A true psychosis, you want to medicate. At the end of the day, if that's what you're
of
dealing with,
course.
medicate it, take it to, take that patient to the
Yep,
hospital, get them where they need to be. Some of these other
that's it.
things dealt with very differently, and it's
No,
tough.
I know.
It's tough. I
Well,
used to work, I worked my way through college in adult group homes. And, we at times had to call EMS to medicate, but like the difference is they were showing up, you had expertise on scene. We would tell them like, "Hey, this patient is XYZ, this is what they need." They would do it. We would get them to the hospital. I don't find, and that was up in Massachusetts, I don't find the same kind of supports when I go to group homes here. I don't
no,
find
you're right.
that that the staff know anything about the clients
You're
that live
right.
in the house. It's a very different, it's very different. It's
It
very,
is. It's a very huge problem.
it is.
But so basically, the answer is in EMS. If your patient's life is going to be in danger because they're going to cause danger themselves, or if your life is in danger, that's a different story. We're going to give medication to try to sedate if we can get, close enough to them. My whole point is you can't deem anybody behavioral or psychiatric until you rule everything else out. Is that a fair statement?
That would be like, that's the other issue, right? That's part of our, that's a big part of the problem, right? Is this a psychiatric or a medical emergency?
Correct.
When I worked with the nonverbal adults, and we had huge behavior changes, the very first thing we did was look medical, right? Because they couldn't communicate, they couldn't tell us they were in pain, they couldn't tell us they were sick. These were people who would often become septic before we knew they were sick, right? Because
Okay, there you go. So, is it also a fair statement to state that in order for somebody to be properly evaluated, we may have to give them a small amount of sedative just so we can do diagnostic tests like blood sugars or EKGs and things like that.
So here's one of the things that I see all the time, right, in EMS in my very short career here that shocks me as a mental health professional is the aversion to doing those small sedatives because in my life, in my world, in that psych world and psychology world, right, the first thing you want to do is make somebody comfortable. And the safest thing you can do, safest way to do that is to medicate them, right? No, it is never good for somebody to continue to be in a highly behavioral paranoid state. Never good. So if you can stop that, the faster you can stop that. So there's such a hesitation to medicate these patients. And honestly, in my personal professional opinion, it should be much more frontline in EMS. We should be faster to do it because restraining somebody physically is so much worse.
Of course.
So
And that's all protocol based too, because in Nassau County, if within 5 to 10 minutes that I feel that I can't control this person or talk this person in or anything, it's not even, like I said, full snow sedate. I don't have to give them, 200 of ketamine. I can give you 5 milligrams of Versed, up to 10, depending on body size, just to calm you down enough so that you don't hurt yourself and we can do a safe transport and a safe evaluation.
correct. And you're doing that person a favor, right? Like at the end of the day, I don't know if any of you have ever been, but put yourself in their position. You're at a high state of anxiety, right? You're panicked, your blood pressure is high, you're sweating. Wouldn't you want somebody these are all physical reactions to, so again, we treat this as if it's not medical. And we wouldn't do the same thing if for other, you took that same patient who's having a diabetic emergency and having the same symptoms. You're not going to be like, well, just in case, let's just take them to the hospital, forget the glucose, who cares, right? So
right. And are you gonna sit there and tie that patient down too and handcuff them to the stretcher? Exactly.
We know it's wrong. We know it's wrong. We have a medication to treat it, but screw it. Let's just go.
No, you're right. So the whole point about this lecture is just identifying the fact that somebody could be having some type of, neurological emergency. We need to protect them and protect ourselves without jumping on top of them. Okay? But unfortunately, if you're like I said, you're out here in Nassau County for like EAB, a lot of them are trained with the officers to jump on top of people and to handcuff people. I don't find that right at all. And now try to explain to family members or friends why you're doing something like this. That's also, everyone has a camera, everyone's recording, and now all they see is EMS on top of this poor person who can't defend themselves. When they don't realize that 15-year-old just punched me in the face and I lost a tooth. Nobody sees that.
And by the way, doing these things right, you give that 5 to 10 of Versed, doesn't work. You're probably looking more towards a drug overdose, right? LSD, one of those things, because
correct,
that will work for most real psychiatric issues. It'll take the edge off. It may not stop the behavior,
right,
but it will take the edge off. Now, when it doesn't, you're looking at something else. That would be awesome.
And that's what I said in my last lecture. I was asking one time, I gave 20 of Versed, 10 of Valium, and still didn't touch this guy. I finally got an order for Benadryl, gave him 50 milligrams of Benadryl, and he finally went to sleep. It ended up being a cocaine overdose, not a psychiatric emergency.
Not surprised.
Nobody was able to tell us anything. So that's why that B52. All right, we have Benadryl, Haldol, Ativan is a nice combination because it kind of takes care of a lot of things.
Right, and unless you're getting a med list with like a ton of benzos on it that the person's on,
right. Which most of our EDPs are usually on the street. Okay, very few of them come out of doctors' offices that have the diagnoses, or they're non-compliant with their meds, so on and so forth. So good. So that took care of a ton of slides. I love it. Thank you, Elizabeth, very much, and please chime in at any time. No, it is great, but. And like I said, going back to the behavioral emergency, it literally is. It was, agree or not, it was summed up by individuals to figure out what a norm of society should be. Somebody with Tourette syndrome can be considered having a behavioral emergency because they can't stop themselves from saying stuff. unfortunately. Yeah.
And
You
not
know,
all behavioral emergencies cause harm, right?
and that's the other thing. So like bipolar, I know plenty of bipolar people who are either one way in their manic state, one way in their depressive state, but would never hurt a fly. It's also
Most.
correct me if I'm wrong, just because you're schizophrenic doesn't mean you're violent either. It's the psychosis.
Correct. Most are
Yeah,
not, right? Most are not.
correct.
Most not
Most are
if
not.
most of
Most schizos are not violent.
correct.
Yes.
Correct.
So,
And impossible to
but
predict.
but that's the answer. Impossible to predict. So always remain on your guard, always have an egress, get your medication ready. Don't surround people. So when those cops do that circle around people, that is a no-no. Okay. Showing people your hands might be a good thing, but like you said, with the eye contact, I know with that with my son. I have to force him. Like when he cries, I'm like, look, you have to look this way. And that's what actually calms him down.
Right.
So,
You're
but I
familiar
know
with it.
him.
Right.
Right, but I know him. Right. Yeah,
Yeah.
exactly. So
You know,
it's
for most, so the best advice I can give all of you for most of these behavioral and even psychiatric emergencies is find a grounding place. You want
mhm,
to find a grounding place. I had a patient the other day, and she was perseverating on her husband stealing her medication. She was bipolar, whatever. And the
yeah,
grounding place, okay, let's talk about the medications. You take this. What do you take this for? Who prescribes it? Who's the doctor, right? Like find a grounding place. Find something that you can talk to them about that has nothing to do with what's happening right now, right?
right.
Take it out.
And
Let's forget this and find a
and
grounding
don't
place.
and don't play with their emotions or feelings, right? A lot of EMS like to
No.
like to egg
And
on.
don't confront. Right. Don't confront.
Yeah,
Don't confront the delusions. Don't tell them that it's not happening. Right. Just find something else. Like, wow, that's a really nice picture. Who is that? Who is that? Is that your daughter? Do you have kids? Really? Oh,
mhm,
okay. Who's your mom? Right. There are plenty of things that you can find in your environment. Look at that tree. What kind of tree that is? I'm wondering. I think it's an oak tree. What do you think? Find something to talk to them about that isn't
mhm,
what's going on right now. Find that, and you can very quickly assess where you're going to be able to go with that by doing it, but stay away from those. Don't confront, don't
yeah,
sympathize, don't empathize. None of those things are good ideas in psych and behavioral emergencies. Not at all.
yep. Now teach that to the 5,000 EMTs and medics that are
I'm
out
working
there
on
right
it. I'm
now.
working on it. That's my project.
In the 3-month EMT school that we give, or
It's
the year paramedic school.
it does it's this is our lecture, right? This is it.
This is it. This is what you get. Learn from it in the street, and if you're able enough to spend time with people, whether it's in the hospital or homes, and you learn about it yourself, it's going to basically be life experience.
Yep, for sure, for
Good
sure. But
job.
honestly, these are the things you need to know, right? You need to know,
Hmm.
um,
Okay,
you
but
know,
like you said, the difficult patient care interviews here. Okay, a lot of you guys, I love, I've just met you guys, but a lot of you do not have that voice.
oh no,
Sometimes it's said that women have the calmer voices. That's not always true either, but
no, 'cause it's
your
so high
voice
pitched.
changes. Yeah, you can
You,
be an asshole and not know you're an asshole just the way you sound.
yeah, and I will tell you, if you watched me on scene, right? The louder someone else gets, the quieter I'm getting. Quieter.
Hmm.
I'll get down to a
Quieter.
whisper. I will get down to a whisper with a real psychosis. And
Hmm.
again, I've dealt with this a lot more than anybody, probably more than I'll ever deal with anything else in EMS, just because of my 20 plus
Right.
years experience in the field, right?
Okay. Address
But
people the way they
the
want to be addressed. No, sweetie, honey, dear. Gotta get rid of those stereotypes there.
yep.
Yeah. Let's see. I mean, geez. Where, like I said, unless you're in your field, you're never going to identify every single DSM-5, is that what it is? DSM-5?
Got it.
Yeah,
Five
yeah.
now. I don't know.
God bless you reading that. I gave up.
Yeah, it's thank God I only had to do that once, and now I just have to read the updates.
Nice. So as far as an exam, we might have scenario-based questions, or you might have something simple as identifying the difference between delirium and dementia. So since Elizabeth is on, can you tell us the definition of delirium?
Delirium is a state where you actually don't know what's happening, but it's a state of like delirium is actually a state of psychosis where you are not
Mhm.
aware of what's
Good.
going on around you, and although delirium doesn't always come with hallucinations, you can actually be seeing things that aren't happening.
That's yeah, very
Um,
good. Okay,
Dementia
so
is lack of ability to relate, know what's actually going on, but a dementia patient is going to see and hear the, things you're saying and understand. They're going to have more difficulty relating to things in the past versus the immediate present.
can delirium be reversed?
Delirium can definitely be reversed.
Yes. So that's another big one, right? Too.
Right, right. Yeah, dementia's it,
Okay,
right?
good.
Dementia's
No, I'm just tacking on,
yes, yes.
tacking on
Delirium,
to what you might
right.
see. Hmm.
Delirium absolutely can be and usually is reversed, right?
Right.
And again, delirium is another one of those things, right? Delirium can be psychosis, delirium can be medication induced, delirium can be coming from a lot of different places where dementia is a very different very different type of process. Dementia's the
Right.
deterioration of the brain.
Al Alzheimer's is a degenerative disease.
Right.
Alzheimer's is degenerative.
Right. That's at the end of the day, right? And that's where you were coming back to, right? You can have
Mhm.
your hypoglycemic patient can have delirium.
Very, yes, exactly. Okay, that's good. All right. So again, like she said, our dementia patient, okay, loss of function, multiple cognitive domains, slow, progressive loss of awareness, just degenerative. Not going to get any better. Can't reverse it. Have you been trying to slow it down? Yes. Okay, more and more medications are out there for Alzheimer's, but once you get to that dementia state, I don't think they've figured out any drugs right then and there to slow it anymore, unfortunately. Okay, but again, same rules apply. We don't play with dementia patients. We don't egg them on. You call them by their first name and you just talk with them. If they want to talk about, their younger sibling during an ambulance ride, that's what you talk about. Okay. And it's amazing how you take their pain away just by, like Elizabeth said, refocusing on something else.
That should always be your focus. Should always be your goal.
Hmm. Yep. All right. We spoke about autism. The spectrum is so all over the place and there's so many tests to it. I mean, it's like you said, you could have so many arguments on autism with a million doctors about it. So a lot of the really autistic kids that I've gotten, I've asked them what's going on, and the mother think, I think she has an ear infection. Well, why do you think that? Oh, she's yanking at her ear. Okay, how do I get your daughter in my ambulance? Well, if I just put her in, she'll walk right in. Okay, can I put her seatbelt on? She goes, no, it's better if you just stay away and I go next to her. Okay, do I have to take vital signs on this person who has the potentiality to be violent towards me? Do you need
Nope.
those? No, no.
No.
I mean, I don't know why EMTs or medics are so fixated on vital signs. If your patient is walking, talking, their skin color temperature is looking good, and their respiratory rate's looking good, then their vital signs are probably pretty damn good too. Okay.
Yeah. You know what? With any of your with any of your psych patients, there are a couple of things, right, you would want to do, right? You certainly want to get a BGL, you certainly want,
BGL,
but
yeah. Mhm.
right, but not with an autistic kid, right? Not with somebody who's you're standing there and the parents telling you this is what's wrong with the kid, this is what's going on, and
Yeah.
be smart. Maria will tell you she's a parent, Anthony's a parent, I'm a parent. If I'm telling you that this is what's wrong with my kid, I promise you it's right.
Yeah, that's true. And a lot of EMS get frustrated because we don't listen to caregivers. A lot of us do not open up our ears because we think they're annoying or they're getting in our way. We have to get that out of our system. You have to take the person who's giving us the pertinent information and take that pertinent information and take that person. I don't understand why people are so against taking a family member in an ambulance, even if the patient's critical. All I hear is, no, 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 they're critical. I can't take you.
That's
Your
stupid.
job is to fix critical. Okay.
Right.
Even if you let them go in the front, your job is to fix, you know, a, I was gonna say an environment, a hostile environment. Your job is to figure out how to work up somebody, okay, while dealing with family members,
Right.
right?
And listen,
Oh,
right, I tell you with autism, right, environment is really a big thing. So lights can be bothersome, noises can be bothersome. I would
oh yeah,
never
noise.
put
Mm-hmm.
lights, sirens on it with an autistic patient unless they were basically unresponsive.
No, you're right.
Because it's just a bad
Yeah,
idea. Bad idea.
yeah, absolutely right. Okay, so listen to people. Listen, 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 listen. Open up your ears, swallow your pride. Okay, figure it out. This was my patient last night. You know, anxiety. Honestly, if you put everybody with anxiety into the hospital, you would fill up 1,000 hospitals in 5 minutes. Okay. Anxiety and panic disorders have risen within the last 10 years. I don't know if it's because what's going on in the world or what everybody or social media. Honestly, social media will be the death of people. It has been the death of people. It's caused more suicides in younger people than we've seen in the last 5 years. So, but last night I understand this woman, she probably had a kidney stone, and I understand that it hurts. But man, you're 68 years old and you're screaming and crying like a little BIDCH. Like, I'm trying to help you, but I have to physically look at you. I just can't throw morphine at you. All right. But people are having panic disorders and anxiety. Honestly, that paper bag or breathing into your shirt, that works. Okay. If you give them oxygen, don't inflate the bag. Oxygen makes it worse. They need that carbon dioxide. They need that reassurance. Put an ice pack on the back of their neck. All
Also
right.
be
People
if you
having,
see
yeah, go ahead.
if you see somebody who looks like they're having an anxiety attack and they're on like things like antihypertensives, they use a lot of those kind of medications for people
Mm-hmm.
with anxiety disorders for
Oh, yeah.
for that reason. So, you that could give you history that you might not. Again, one of those off-label prescriptions,
Mm-hmm.
right? My daughter's on Inderall for
I was just
anxiety.
saying, I was on metoprolol.
Yep. Happens
Yeah,
all the
beta
time.
blockers. Yeah, you'll see a lot of young people on beta blockers just to control anxiety and heart rates.
Yep. So
Yep.
keep that in mind. Like you have somebody that's
Hmm.
behaving like that and you see those meds, it's probably a
It's probably anxiety. Yep.
stallings, right? No
And
matter what they say.
anxiety could cause heart attacks. Anxiety can cause strokes. They can cause arrhythmias. So I know we roll our eyes a lot. Last night, I really was trying not to do it because I was helping this woman. It's just and she was great by the end. But people don't realize that as fast as I work, I just can't give you something because you tell me to. All right. We have to talk about this a little bit, and I have to get a history. All right. But calm, cool. If you can get down to the underlying reason why it happened, it might help. But be careful how far you dwell, because a lot of these things, people can be abused. All right. Mental, physical, sexual, right? Child abuse. You don't know PTSD. You don't know what caused the anxiety. All right. So you can ask a couple of questions, but if people look like they're shutting down on you, stop your questions. Name and date of birth is the only thing you actually need for a PCR is a name and date of birth.
Right. Well, and I'll go back to, right? Let's go right back to, we're not talking about what's going on right now. We're going to talk about something
Yeah.
else, right? Do not tell somebody who's having a massive anxiety attack that everything's going to be okay because
Oh, that's the
that
worst
is,
line right there.
yep, right? And I hear it all the time, right? Like everything's not going to, it may not. So, right? Just stop. The
That's
ambulance could crash on the way to the hospital. I mean, like, stop making promises you don't know. And let's talk about something else, right? Again, like
mhm.
refocus is always your best.
Yeah, lines you should never say to your wife. You're fine. I'm
Or,
fine.
or
Oh
anyone
yeah,
yeah, bad idea, bad idea.
we can laugh about that. But it's good. It's good tips and advice. But honestly, until you're put in that situation, you're the medic, you're the EMT, you're the one that's got to figure out what to do. And I can verbal vomit as much as I want to, but you guys have to make the sound decision, and hopefully it's like the right one. And then the other issue is taking them to the appropriate facility. Nobody wants that job at the 5-minute end of their shift. All right. But you sit there, you diagnose the fact that it's a psychiatric, you ruled out all of the medical that it could be. They need this hospital, but you're going to take them to the closest hospital because you want to get off on time. That's another issue that we have. Hospitals, okay, a lot of hospitals, as we know it, don't have internal psych. You have to take them to specialty centers, right? Even those specialty centers may evaluate them and let them go. That's not up to you to decide. All right, but take them to the appropriate facility too.
Also control
Right?
your scene, right? You are the professional there, not the police, not the other people. You need to control your scene. You need to have the guts to stand up and say, guys, I need you to back off. I need everybody to stand over here. You really have to control your scene. That's probably one of the other hard parts. You can't be the one backing off and waiting for them to deal. You've got to deal.
Right. No, you're right. It is hard. Not easy, this field.
No.
All right. Phobia. We all have fears, okay? But a phobia will kill you. Okay? A phobia, if you are so, I'll give you an example. My girlfriend is such an arachnophobe that she was a passenger driving down Merrick Road. A spider, Little Miss Muffet, spider sat down beside her. She jumped out of the car onto Merrick Road. That is a phobia. You can kill yourself with phobias. Not just having a fear of things. Like, I am afraid of heights. I shake when I get up there, but I've been on roller coasters. I've been on the roof of my house. An actual phobia can cause somebody to go into arrhythmia or cardiac arrest. All right. So another form that we have to, try to just turn the conversation somewhere else. Okay? You get to somebody who's agoraphobic, who hasn't seen the outside of their house in a year. We call it COVID. We created a lot of different types of phobia during COVID. If you try to drag agoraphobic out of their house, you might kill them. All right, this is the baby steps. I always go back to Shameless with what's her face? I can see her. I can see her face, but she wouldn't leave the house. It's baby steps. People don't realize that when they're in their environment, they feel safe. Taking them out of their environment is not safe. All right, so just be wary about certain fears. All right, OCD. A lot of us have OCD. I have OCD. I have body dysmorphic disorder. I mean, I go up and down in weight all the time. I can never say a trichotillomania, right? You pull your hair out. Excoriation, that's when people yank at their skin. All right, probably eat it too. So people that yank their hair out, pull their skin out, eat their skin. All right, these are all OCDs. All right, you're not going to fix an OCD either. All right, so if somebody says they have to go inside just to check if their oven's off, let them go inside. If somebody has to sit in a certain spot, like you're Sheldon and it's your spot, that's where they sit. Fine, no problem. All right, some people are on medication. Some people might not even realize they're doing it with OCD. PTSD, Elizabeth was saying, making eye contact with some people, honestly, smiling at some people too. I've smiled at people and I've set them off. All you need is that trigger word or that trigger maneuver, and you set people backwards. Okay, so just be very careful what you do. All right, but what you do for one person may not work for the second person. And that's another thing you have to remember. So all your techniques for treating this Marine for PTSD may not work for somebody who is just involved in in the Army in something else.
That's why it's hard to teach, right? That's why this is really hard to teach. It just is.
Right. And there's no answer to it. It's just,
I can't give you a script, right? I can't
No.
tell you ask these 10 questions. I can't do that.
no,
It doesn't work.
no, your safety, your patient's safety, and that's what's most important. That's all I can keep saying about this lecture. All right. I love mood disorders. We all have mood disorders. But again, if I took everybody to the hospital who has depression, I would fill up 1,000 hospitals. But again, people don't realize how depression affects family members and other people. Okay. Depression will, if you are depressed, your family will feel it, children will feel it. All right. It is another thing. And you just can't tell somebody, come on, let's go outside. And the worst part about depression, and I'm sure you'll agree, is you can't tell somebody that they're depressed either. That's like I've learned that a lot to people. Be like, yo, you're depressed, you need medications. You can't do that either. It's something that somebody has to accept and want to treat themselves.
Yeah,
I do it for
unfortunately,
my mother.
right? These are the things, right? Rock bottom before usually treatment, unfortunately. It's very sad to
Mhm.
watch, but yep.
It is. I mean, you know what? Nobody has to say anything, but if you've ever found yourself at the bottom of a beer barrel, okay, or a bottle of wine after having three of them, you'll know when you hit rock bottom. And you're right. Sometimes it's the only way that you'll change yourself around. But you don't know why this person's depressed.
Right.
And
Well,
what
that's the
always
other thing.
kills me is when I get these 8-year-olds. Yeah. I mean, have you done children? Like you get 8-year-olds who are depressed and you're wondering what could have happened in that short amount of time that made this child like this. It's very
Like
sad.
suicidal, right? How you have 8, 10, 6-year-old suicide. I don't,
Yeah.
it's really hard to fathom, but again, like that's where you go back to again, there's episodic and situational depression, and then there's actual chemical depression, right? So there's two very different root causes.
Right.
Depression can be behavioral or environmental or episodic, and it can be completely a chemical imbalance in the brain. And so for some of those younger kids that you see with those kinds of things, it is actually truly
Mhm.
a chemical psychiatric issue versus um, 7 people in my family just died. That's expected.
Correct. Oh, yeah. And then, like I said, the social media. God forbid a video of you doing something or whatever, a photograph of you gets out. We're going to talk about suicide in a moment. I mean, the amount of suicide in from the ages of 10 to 17, I believe has like tripled or quadrupled in the last 5 years. It's really a staggering number. It's just so sad.
I think it's
You
doubled
know,
since COVID.
doubled. Yeah, I mean, and then you get EMS, fire, police, and EMS with, if I look at another Facebook post of another paramedic or firefighter or cop who, thought that this was the best way out, every single like day I'm getting a new update. And that's why we keep saying, there's always somebody to talk to. We need to find somebody to talk to, but you have to admit that you have an issue first. Okay, so please, like I always give somebody my Google number. If anybody needs to talk, it's on 24/7. I'm always here. And I've been on this other state. I have my own therapist, my best friend in my entire world. She'll answer my phone call anytime. This job creates depression. I mean, COVID, I talk to my friends, they're a lot of them are in therapy because of COVID. They've just seen so much sadness and so much death that they just can't cope with it. Right? We need to get professional help. Right? But unfortunately, how many people here work the city? You just had a 1-year-old in cardiac arrest. You did your job and you're almost in tears, and the lieutenant goes, go back in service. How often does that happen? And if you don't tell me it doesn't, all right, I'm going to come through and choke you, because I've actually told lieutenants off, like I'm allowed a CISD. All right. But in our job, it's basically suck it up, buttercup, deal with it, go on to the next job. And that's a problem in EMS. Right. Spoke about bipolar. Okay. So suicide. All right. Let's see who's on here. Who is on my first page right here? So I got Ramses on my first page. Ramses, how are you? Okay. How do most men commit suicide? What are their means?
Uh, Firearms?
Okay. Anything else?
Well, I would think they're a little more direct. Um, so I don't know. Car accidents,
Okay,
or-
intentional stuff, right?
yeah.
Chumps.
I I would think women is more like indirect
Okay.
medications, probably hanging or other
All
things.
right. All right. So men tend to have more violent deaths, where women are so vain that they want to have the pretty death. So most women will choose drugs and poisoning over like the hanging or the firearm. Yes, you do get women who slit their wrists and sit in a bathtub. I understand that. But it is safe to say that more men will see a violent death and more women will have a vain death. Okay. And if you ever go to any of your suicide calls, okay, you'll note that. Okay. Most, like I said, most men that I have treated for it have tried to hang themselves, shoot themselves. At that car accident, we actually had a paramedic. He was so depressed, he strapped a machete to his steering wheel. So when he hit the brick wall, the airbag deployed and the machete went right through his chest. He did not want any paramedic to fix him. He was in this field for like 30 plus years. All right. Those, unfortunately, those people with the thoughts are not going to be fixed. But there are some clues around you. All right, Alyssa, you still with me there?
Yeah.
What are some kind of hints or clues that some people might do just to kind of, like I said, clue you in the fact that they might be contemplating suicide?
Like as if like their body language towards you or
Okay, so the person who is normally like happy-go-lucky and love the world all of a sudden becomes, depressed.
like
They stay in
distant.
their room, distant, right? Good, good, very good. Brendan, what do you think? What other signs do people do?
People start to withdraw from their friend groups or anything along those lines.
Okay, well that we just said that your behavior changes, you become distant. Okay, yep, not showing up to work. Good.
Their appetite.
And okay, you can, yes, I have seen ones where people they try to feed them and there's food trays outside their room.
Tying
Yeah.
up,
What's
wrap,
ADL?
right,
Genshin, what's ADL?
activities of daily living.
Oh, thank you. Yes. Okay, so activities of daily living. All right, they alter that. Very good.
I know
I would
sometimes.
also say be careful when people are wrapping things up and telling you things
Yeah.
and whatever, especially with older, like those older white men suicides, right? You know, here's the bank
Uh,
information and what.
Okay, I was just gonna say giving away your prized possessions,
Yep.
giving you info to things, that's a huge clue. If somebody gives you their necklace that they've had in their family for 30 years, could be a huge clue, right? Showing you where everything is in the house. Yup, yup. Who else had something?
I know sometimes like the opposite, like family members will say that they're happy in like their last few days, that they start to get better, they start to like make amends because they've made.
Okay, make them. There you go. That's the word right there. Make amends. Yeah, you go. Do all your confessions. Very, very good. Anything else that you notice?
Well, also do exactly what he said, right? When people have a decision and a plan, the
And a plan. There you go. Yep, a decision and plan.
when they decide and they figure it out, so somebody that you've seen in severe depression for a while and all of a sudden they
Mm-hmm.
don't seem depressed anymore, do not assume unless they've gotten really good treatment that they've gotten better. Oftentimes that's
Right.
not the case.
I mean, we learned this from Robin Williams. The day after Robin Williams committed suicide, the suicide hotline shot up 70% in call volume. Because how can somebody who've made people's lives, they made them laugh, he's made you cry, he is so happy in life, do this? We just never know. You never know what somebody's insides are telling them. All right. So if you see any of this, excellent job, guys. If you see any of these signs, symptoms, or anything, changes about somebody, okay, you should try. Like I said, you have to be careful how you ask questions and how you dig deep into somebody, but you should probably keep an eye on them, call them. All right. There's gotta be something must have happened to them that made their life that bad.
And always remember, don't try to fix, just try to be there, right? At the end of the day, that's always the thing. Somebody's dealing with, that this goes for anything, right? You have somebody and, just had a critical incident or somebody who's whatever, if you are not a mental health professional, don't pretend to be one. Don't be judgmental and be there. Just be the person that they can talk to, because especially in this field, it's a fairly well proven fact that they need to talk to people that they think will understand what they're going through. And so sometimes that peer to peer is better than a professional, but only if you're not sitting there saying, yeah, I remember that time, or yeah, this, or yeah, that. You got to try and be there. Just listen and hear it.
Right. Like I said, thank you for that. And I'm sorry. Sometimes, especially if we're in class, I have some people walk out on this. Like usually everybody here knows somebody or of someone that this has happened to. And it's a very hard topic, but it needs to be spoken about, because the more you keep it in and the more you don't speak about it, the problem doesn't get solved. All right. So just be aware of surroundings, be aware of your friends. And that's basically that. Another test question that I've seen out there before is Munchausen syndrome. Okay, and then Munchausen by proxy. I have had Munchausen patients. Oh my gosh. One of mine was actually written in the thoracic journals of thoracic surgery. He would go all over the world complaining of cardiac issues. And he actually got a doctor in England to open him up to do surgery on him. And I mean, he carried his x-rays around. So basically, he wanted numerous surgeries done to him. All right. I've had people swallow things in the ER, like all that stuff that you see on the shows. You're like, no one will ever do that. Oh, no, I've seen it happen. I'm like, oh my God, I can't believe they swallowed that. Okay. People tend, whether they want to hurt themselves or not, so they can't help it. The worst is the Munchausen by proxy. Okay, this is the sixth sense. These are the mothers, okay, that hurt their child. Elizabeth can advance on this. I don't think mothers really want to hurt their child. Some are just looking for attention because the child has taken the attention away from them, from what I hear. Okay,
Yeah.
can you agree or disagree?
No, that's exactly right. This is it's a narcissistic.
Narcissistic, there you go.
Right. So it's a Munchausen by proxy is a narcissistic syndrome, and they will typically try to do things that are not actually physically long-term harmful, but not always, so smart about it. And a lot of times at Munchausen by proxy, there's actually more times than not, there's nothing wrong with the kids. It's more like what you were saying, where they don't actually cause harm. Pediatricians probably see this all the time. Those parents that are constantly in the office, there's constantly something. I have a friend
Yes.
who's like this. I mean, there's constantly something wrong with her child. And I laugh as somebody, as a parent, and I'm sure you too, Maria, as a parent of children who actually had like massive medical issues. Like, why would you want to do this? My child was in the hospital once a week, every week for 2 years. Why would anybody want to do this?
Well, but that's just it. Why would you want to bring? But unfortunately, people have their own, whatever mental disorder they have, and they feel like they have to do this. So Munchausen by proxy, it's when a parent hurts somebody else. It could be their own parents. It doesn't have to be a child. It can be your own parents. All right. So I've seen questions on that too. But oh my God, Munchausen patients themselves, some of them are buck nuts crazy. Like, holy crap. Whether you call it OCD or you get all these Lifetime movies where people eat their own couch cushions. Okay, they've got a combination of OCD and Munchausen and other psychiatric issues, but I don't know why a couch cushion looks delicious to you. It is to people.
Yeah.
So,
See some strange stuff out there for sure.
yeah, really, really bad. All right, please know the difference between anorexia and bulimia. All right, it's not difficult. Okay. anorexia, severe weight loss, malnutrition, intense fear of being obese, all right? Bulimia, okay, the insatiable craving for food, okay? And mind you, bulimics are probably overweight because just because you eat it and you purge it doesn't mean you lose weight. Okay? Anybody know who the first person, okay, to diagnose bulimia in somebody would be?
Dentist,
Yep, dentist. Why?
the rotting of the teeth.
That's right. Good. Yep. All the acid that comes up, it wears away at your enamel. All right. So, but yeah, bulimics are probably not thin. Okay. Because even though you're eating and you're purging, there are still like, nutrients and carbohydrates and stuff that is still being absorbed in your body. There's sugars, there's salts, everything else. Okay. And an anorexic, you just can't tell them to eat. Right? If somebody is anorexic for so long and you give them a full tray of food, you might kill them. Anorexics are deprived of vitamins. They're deprived of nutrients. They have to literally be baby bottle fed, every 30 minutes to an hour just to introduce food back into their body. Okay? And it doesn't matter how thin they are. Anorexics will never believe that they are thin. They believe that there's some type of body dysmorphic disorder. They'll find fat somewhere. Okay? And social media is not making this any better. I'm sorry, James, I'm just reading this right now. Famous case of lunch. So there's 7 of her. You see, that just makes me cry. That just absolutely makes me cry because I've had cases, a mother, her twins died a year from each other. This happened in Flushing. And so I'm working up this dead 8-month-old that looked like she was 4 months old. And there's another child in the house, but she killed both of her twins. So it's sad. After having a child, I can't deal with this anymore. And I probably want to choke somebody if I ever saw this. But it's very hard, emotionally you have to swallow a lot of things. But that's why I can't watch the news either. All right. If you're a kleptomaniac, knock it off. And the funny thing about kleptomaniacs is you might not even steal things that matter. It's just the fact of grabbing something and putting it in your pocket, which I always find really funny. Just like a random object you'll just put in your pocket.
It's all for the high, right? It's all for
It's
the,
all for the high.
for
Yeah.
the endorphin or the elevation.
Yep. Same thing with gambling.
Yep.
Yes, you want to win money, but it's all for the high. Pyromania, same difference. Nobody wants to burn their house down, but people love looking at fire. Fire releases endorphins. It makes you happy. We have all these firefighters out there that love it. So, yep. I mean, medication. Yeah, it's true. Oh, there you go. You're DSM-5. All right. All right, we talked about problems in children. You have pediatric lectures coming up. Remember, restraining a child is not easy. Okay, if I know we have the PD mates, some children are comfortable in their parents' arms, but if a child looks comfortable with a parent, that's a good thing. Separating a child from their parent is very difficult, very hard to do an exam. All right, but again, if you know they have an underlying behavioral psych issue, hey, we are going to have to work with it, right? And there's no right way. There is no right or wrong way to, there's definitely wrong ways, but there's no easy way to treat these guys.
Just make sure you're never compressing the chest when you're restraining a child.
Oh my God, I don't understand that.
People
I
wrap, oppositely, and it's bad. It's bad.
It's another reason why you don't transport somebody prone unless they have COVID, or unless they have back problems where they can't lie supine. Nobody should be transported prone unless you have an underlying medical reason to. You can kill somebody like that. All right, we touched on all this. That's great. Our potentially violent patient we spoke about. I love my posies. People rip through posies too. Just because they're soft doesn't mean that they're going to help your skin. All right. If you get ketamine, I would I have never been able to use ketamine on humans. I've used it on animals and it works amazing. If I had a choice between benzos and ketamine, I go right for the ketamine. And Elizabeth agrees. So I'm hoping, Yeah, I'm hoping that ketamine becomes more available to us in the next couple of months, not even years. It's supposed to, it's in our protocol. But definitely, if you have ketamine, use it. Just use it in caution. A reason why they're being held, you got some ass of a medic in Wyoming that gave 400 like micrograms or some ridiculous dose to a patient and killed them. You know, so we have to be careful. We just can't give a med because, you know, it says we can. We also have to monitor airways and monitor our patients. But ketamine's a wonderful drug, nice sedative hypnotic, and it will work on those violent EDPs better than benzos.
I have a question about that. So when we
Go ahead.
had ketamine introduced at work, I was there and all the medics were going through it, and
Mhm.
only two of them were like, "Oh, I would be comfortable using it," as opposed to Versed, and they're both ER nurses as their A job and medics as their B job. And they were
Okay.
like, "Oh, we use it on peds all the time for like
Mhm.
local sedation stuff." But
Okay.
it seems like it has such a dissociative effect where like it can cause more psychosis than it does, you know, like downer effect, as opposed to like your benzos have the downer effect, which isn't that what you're looking for when you're using it?
Do you know what
You're
the,
looking,
you know what the
I've
antidote
used it a
for an
few
overdose
times
of
on
ketamine
jobs and
is?
it works great. I've
The
sedated
antidote
many
for,
people with it.
right. The antidote for an overdose of ketamine is more ketamine. If you
yeah,
get
so
agitated, you didn't give enough.
No, but I'm
yeah, I
saying
mean,
like, doesn't it give you that psychosis effect as opposed to Versed is like the downer effect?
So it can, right? But usually most of the time, right? So if you look at your ketamine dosing in protocol, it's 0.5 to 2 milligrams kilogram, right? For an agitated patient. And usually if you get that sort of psychosis effect, you've underdosed the ketamine.
yeah, morphine can make you psychotic too.
Yeah, anything can.
Hallucinate. Yeah, anything can.
Anything
So
can.
I actually had a patient on Saturday at Jamaica EMS who he had snorted ketamine, and his mother found him in his bedroom, passed out. And she called 911 for us to transport him, and he ended up being one of the funniest people I've ever met. He even requested music in the ER, and he was a bit like out there mentally. He was like he was a bit hypotensive, but not to the point that it worried the mother. And I think that the ketamine just knocked him out.
Ketamine has really nice dissociative effects.
yes, it does. So can I tell you, under NASA protocol, I mean, it's a medical control option for the more, but we can give 250 milligrams at a single dose.
For an
Just
agitated
for an
patient.
adult, yeah, for excited delirium, you
Yep.
know. So it's a high dose, and then that dose can be repeated. So we can give 500
Yep.
milligrams.
Yep,
You know,
and truthfully, if you give the 250 and you have a bad effect, you need to give the other 250.
you need to give the other 250, right? And then it goes into the 0.5 to 2 milligrams on the medical control. Because now I don't know why I said micrograms. I made a mistake before, but I have to look up. It was a paramedic in Wyoming, but he gave such a ridiculous amount at one time, and he didn't monitor the patient. The patient did die. Right. You also, when you do give this drug, you have to monitor airway, you have to monitor vitals. They have to be, if you have a capno reading with an EKG on, I mean, that's what you need. You just can't.
Which you should be
give
doing
them
on
things.
benzos too. I mean, if you're sedating somebody,
Yes.
that's good medicine, right?
Yes. All right. Any good medicine, you should have them on a nasal cannula just for even passive oxygenation. I mean,
Right.
but people forget all this stuff.
Yes. And end tidal and cardiac monitoring should be on any of your patients that you're sedating.
Mhm.
Let's be real.
Yeah.
And you said micrograms because fentanyl, right? That's
Yeah, so
the
Stephen, I wouldn't worry about what could happen because just like I said, any treatment can have an adverse effect on anybody, just like giving me Benadryl. It might help an allergic reaction, but I'm going to be wired all night long. That's not your problem. Your problem is to treat signs and symptoms and patient safety and your safety right then and there and monitor and let everything else deal out later. You know, so that unfortunate 1% of patients that have an adverse reaction versus the other 99 who it helps. You understand? So
Yeah, I get that.
anything can, like I said last night, morphine can make you hallucinate.
Right. And you can get
Yeah.
bad effects with benzos in just the same percentage, right? Not everybody responds well to benzos. Some people get more agitated. So you always have